We're off to a rough start with flu cases this season.
Joining us now is Onondaga County Health Commissioner Dr. Katie Anderson. Always good to see you. Thanks for being here.
Good to see you.
So the flu numbers statewide are out. They're a little bit of a lag, but they're up 80% as of the end of November. We're over 200 cases here in Onondaga County. How concerned are you with those numbers?
Flu season is clearly upon us here. Like you said, we're starting to see both in central New York and statewide numbers ticking up, both in terms of confirmed illnesses as well as hospitalizations, and also concerningly in our older adults. Last week, New York State Department of Health declared influenza as prevalent, which means that now flu season is here. We're seeing transmission in multiple counties at high enough levels, so we are heading into the thick of it.
All right, so flu cases are up. How about flu vaccinations? Are enough central New Yorkers rolling up their sleeves to get a vaccine for the flu?
We are not yet where we would like to be, or maybe where we should be in terms of flu vaccinations. I'll say that as we look back over the last 10 years, unfortunately and concerningly, we've started to see vaccination levels for flu go down, and that includes in those over 65 who are at highest risk. This year, it's about 20% overall of people in the state have gotten their flu vaccine, about 25 to 30% here in Onondaga County, so we are far off the 70% target of where we should be.
That's exactly what I was going to ask you, is where we should be is 70. So yeah, we are a long way off. All right, I have heard, and we have talked, I think, to you before, Dr. Thomas, definitely about this, that the vaccine may not be matching up super well with the strain right now. Why is it still worth, though, going out and getting the vaccination?
I appreciate that question, because folks may be seeing in the media or elsewhere that there's this new subclade K, which is a slightly evolved or mutated strain that's not a perfect match for the vaccine viruses that are in this year's flu shot. That said, the vaccine protects well, even if it's not a perfect match in the southern hemisphere. So last summer was their flu season. It's still protected. About 30 to 50% of hospitalized cases were prevented with the flu vaccine. So we still strongly urge anyone who's not yet gotten their flu vaccine to get it now. And the good news is that if you get it now, you'd be protected in time for the holidays, because it takes about 2 weeks for that protection to go up.
All right, still not too late. All right, we want to get your opinion on this. We had Dr. Thomas in the studio with us yesterday, infectious diseases specialist, very concerned about the decision by federal vaccine advisors to change the hepatitis B schedule for babies. Very concerned about it. Are you also concerned?
Well, I'll start by saying that there's not any new evidence or data that prompted that discussion. What we do know is that for decades and over billions of children vaccinated, that this is a very safe vaccine and that it's worked very, very well. Dr. Thomas mentioned 99% decrease in hepatitis B cases, which means it prevented chronic infections, liver disease, cancer, and even deaths. So changing this guidance and the lack of evidence means that we're accepting that there will be future preventable chronic diseases, infections, and even cancers that could have been averted, and for a decision that was not based on any new evidence or data.
So with so much confusing content, let's say, out there on vaccines, what is your advice to parents overall, whether it's hepatitis B or flu or COVID, and the list goes on, measles, etc.? What's your advice for parents right now? There's just so much out there.
It's never been a more challenging time to try to navigate and get to the right information. And first, what I wanted to say is I applaud, and it is completely normal and welcome for parents to want to make the best informed decision. It's challenging when what used to be the gold standard institution for evidence-based policy, the CDC, is no longer basing their decisions based upon science or data. The good news is there's still a lot of other resources. So your physician, of course, county health department, state health department, and then professional associations like the American Academy of Pediatrics. They have not changed their recommendations or guidance, and they remain good sources.
Well, so many of us like to do a year in review when December rolls around. We'd love for you to do that now. If you take a look back at 2025, what do you think were some of the biggest steps forward for your office? Most proud accomplishments for 2025?
There's a lot of them, and I like that question. Thank you. A couple that come to mind. One would be in our harm reduction or substance use initiatives programs, so supporting people who use drugs and helping them get into treatment. We've gotten out into the community more than ever with new programs, and we continue to see decreases in overdose deaths. Another highlight I would bring up is lead. So we continue to have high testing numbers. We continue to engage the community, and at the county, we now have more programs than ever to increase trained contractors, get into more homes, and really get to the source of the problem.
Excellent. We'll keep your 2026 issues for when we have you back in January. Dr. Katie Anderson, thanks so much for stopping by. We always appreciate it.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.